Hi everyone. So I did my topic on mental health services in rural and urban settings. Um, so basically, I found that mental illness is actually not uncommon as many people think it is. In fact, 25% of adults have a mental illness, according to CDC, and among them, at least 15 million rural residents struggle with significant substance abuse, mental illnesses, and multi conditions. Regardless of your background or family or status, like anybody can be affected. And I feel that a lot of times people forget that. They're just like, oh, I'm from a good family. Like, I don't live in a poor neighborhood. I'm going to be fine. And oftentimes that's not the case. Um, there's actually been studies that show serious mental illness is generally higher in cities compared to rural areas. And some examples that are higher in cities is anxiety, psychotic disorders, mood disorders, and addictive disorders. That's usually in regards to different social or physical environment, and like poverty, traffic noise, which can turn into stress, the lack of nature. I know a lot of times if you're in Seattle, depression is pretty high because there's no sunshine. It rains all the time and it's always foggy. And also the pollution in the air can affect that as well. Um, Sorry, I'm reading my slides. But some other Oh yeah, and one more is physical threats such as accidents and crime. I know that would cause my anxiety to go up if I'm constantly worried about if somebody's gonna rob me or shoot me or do something. Um, so I found that a lot of articles talk about how mental illness in rural communities is similar to those in cities, and the large difference is the amount of services, the amount of providers, and the financial aspect. So, for example, urban areas have been associated with better mental health due to the better access to resources such as parks, playgrounds, health, and social care. If you're if you're in the sticks and your population is maybe like 500, there's not going to be much resources for you. You're going to have to travel to the city, to the next town, and if you have transportation issues, then how are you going to get help? Um, as far as a theoretical framework, I found that the matrix model would be best suited to help increase the mental health services, especially for the rural area, but also for maybe possibly decreasing issues in the urban area, because the matrix model is two dimensional. It looks at geographical areas, and it also looks at the inputs, the processes, and the incomes. In regards to geographical, it's based off of the country, if the area is local, and the patient or client, as you want to say. Also, there's four A's associated with services of behavioral health. You have availability, accessibility, affordability, and acceptability. I felt that those could be very, very helpful in better serving the rural population, but also the urban population. When thinking about these people, we should use the four A's to gauge how to better serve them as social workers. So, as availability, you have staffing or service shortages, limiting services, accessibility, when and where to obtain services and transportation, affordability. So, is the care I'm receiving, can I afford it? I know with the patients I work with who need mental health, they can't afford it. So, a lot of times they often turn to substances to help, I guess, try and self medicate. Um, and also acceptability. Are they even open to receiving help? Especially in the African American community, I know we're starting to speak about it more and to actually seek help outside of our home, but it was once like a stigma. You don't go get help from somebody else; you just handle it in your home. Um, So also, there's many programs set in place to assist those with mental illness. Not only the individuals suffering from it, but also the people who are in their everyday lives. So there's programs set in place for their support system. The top three programs that I found nationwide was NAMI, which is the National Alliance of Mental Illness, um, NIMH, which is the National Institute for Mental Health, and SAMHSA, which is Substance Abuse and Mental Health Services Health Administration. So NAMI, I interned with NAMI in South Florida as an undergrad, and I remember running groups focused specifically on the families to help them understand the certain mental illnesses that their significant other, mother, brother, whatever they might have, and to better be able to serve them. But also, we had programs to, if you were diagnosed with something, we were able to, one, get you a support group, but two, also help you to understand, um, furthermore, what you have, how to live with it, and how to be normal with it. Then you have the National Institute for Mental Health. Their main focus is for research on mental health disorders. So this program allows us as professionals to understand the disorders in a broader spectrum. Also, they do partake in outreach, which include the patient, family, and healthcare professional organizations. And they do a lot of work with Congress in regards to being a liaison between mental health professionals and the government. They also propose different policies and bills to Congress. So they're the ones who intervene because they have the research, but they also allow us to further further know about the diagnosis. Then we have SAMHSA, which strives to improve the quality and delivery of behavioral health services in America. SAMHSA, I found on their website, they actually have the most programs, ranging from Medicaid-assisted treatment, faith-based programs, services in case of disaster, and even programs for people of Hispanic culture. I found that the program for in case of a disaster was super important because if you think about, take Hurricane Katrina, for example, I'm pretty sure people were not able to get medicated. And so being able to have a program set in place to keep these individuals on their medications and not have them go without is super important. And that's actually something we don't really think about. I just found that after doing the research, it it really doesn't seem fair that if you don't have any money, if you don't have transportation, if you don't live in a well populated area, you're probably not going to get the services you need. One, you're not going to a social. I'm pretty sure many social workers or even healthcare professionals are just like, I'm not driving an hour out of my way to go help somebody when they can just come to me. But oftentimes we don't think about that. I mean, as far as funding goes, if that were to increase, I'm pretty sure the mental illness like services would improve as well. But it just goes to show you that you can't take things for granted. You have to be willing to be open and enjoy and love your job and be an advocate. That's all I got.